I recently saw a patient in my office who was petrified to come see me after she was diagnosed with uterine prolapse because she thought the only treatment for a uterine prolapse was to consider a hysterectomy, which is a surgery where we remove the uterus from the body. Little did she know that there's so many treatment options to treat pelvic organ prolapse, and oftentimes it doesn't even need surgery. Hey everyone, I'm Dr. Nabila Noor, a board-certified and fellowship-trained urogynecologist and a pelvic reconstructive surgeon. If you're new to my channel, welcome. And if you like what you see, then definitely subscribe and also share it with a friend. They will thank you. So let's start with what is uterine prolapse. Uterine prolapse is when the uterus and the cervix is trying to push through the vaginal canal, and that's because of the weakness of the pelvic floor support structure. So instead of the uterus being inside your abdomen, it's essentially pushing through the vaginal canal and trying to come out of the body. Now, when we stage prolapse, there are different stages we use to grade the severity of the prolapse. So stage 0 is no prolapse at all, meaning the uterus is exactly where it's supposed to be in your lower abdomen. Stage 4 is pretty much everything is outside the body, meaning the whole uterus has come through the vaginal canal and is actually sticking outside the body. When the tip of the uterus, which is known as the cervix, is right around the vaginal canal within a centimeter, we call that a stage 2 prolapse. So anything between stage 0 and stage 2 is stage 1 prolapse, and anything between stage 0 and stage 4 is a stage 3 prolapse. The reason it's important to understand what the stage of your prolapse is, because as you can imagine, the more severe the prolapse, the more uncomfortable patients are going to be, the more bothered patients are going to be. And so anybody with more advanced stage prolapse will most likely need more invasive treatment options to address their symptoms of pelvic organ prolapse. So then let's talk about the treatment options. Just like anything in medicine, we always start with conservative treatment options first and then move on to something more invasive or surgical. What are some conservative treatment options for prolapse, or specifically uterine prolapse? Number 1 is pelvic floor exercises to help strengthen your pelvic floor muscles so that it can help support the uterus better so that the uterus doesn't push through anymore. Oftentimes, pelvic floor exercises are synonymous to Kegel exercises, which is a specific kind of exercises designed to improve the strength of your pelvic floor muscles. The problem is many patients find it difficult to do these Kegel exercises correctly because unlike your biceps or your ab muscles, you can't really see your pelvic floor muscles, and that makes it really difficult to understand whether or not you're doing these exercises correctly. So oftentimes, if I have a patient who really wants to focus on pelvic floor exercises, I will recommend that they work with a pelvic floor physical therapist. Now, a pelvic floor physical therapist is a specialized physical therapist who specializes in taking care of women suffering with these kind of conditions. They usually have a lot of experience taking care of women just like this, and they can guide you and oftentimes can use biofeedback and specific gadgets, cues to help patients understand to make sure they're isolating the right muscles when doing these Kegel exercises. Now, another thing to remember with pelvic floor exercises is just like any other exercise, it takes time. You don't go to the gym one day and expect a six-pack ab. Similarly, pelvic floor exercises to strengthen your pelvic floor muscles do take time. So I'll tell patients continue to do them for at least 3 to 6 months consistently and properly before you start expecting to see results. Now, Kegel exercises can be done anywhere, laying down, sitting up, but make sure you do at least 10 to 15 repetitions, at least 2 to 3 times during the day to start with, to get into the habit, to get into the practice so that you can be more consistent and help improve the strength of those pelvic floor muscles. Number 2 is using a pessary. A pessary is a specific kind of vaginal insert that is made up of silicone, and the idea with the pessary, which usually looks like a ring or a little donut, and there are many shapes and sizes, we put the device into the patient's vagina, and the idea is that it will push the prolapse back, in this case the uterus and the cervix, back to where it belongs and act as a barrier preventing the uterus from coming down anymore and outside the body. So again, it doesn't fix the problem because the prolapse is still there because you're not doing anything to correct it, but with the device you can push the uterus back to where it belongs, taking away those symptoms of heaviness, pressure, bulge that can happen with pelvic organ prolapse. And finally, if these non-surgical treatment options don't work for you, then there's some amazing surgical treatment options, oftentimes done using minimally invasive techniques, meaning tiny incisions either through the vagina or through the abdominal wall. And the beauty of these minimally invasive surgical techniques are, even though we do major surgeries, patients are going home the same day. Their recovery is much faster, pain control is much better, there's minimal blood loss, but most importantly, the surgical outcomes are excellent and it helps improve patients' quality of life without causing them a lot of difficult recovery. Now, the question often comes up, if I have uterine prolapse, should I or should I not have a hysterectomy at the same time? As I mentioned, hysterectomy is a specific kind of surgery where we're removing the uterus. Now remember, prolapse is not a problem of the uterus. The uterus is just an innocent bystander. So whether we remove or keep the uterus doesn't really make a difference for the prolapse, because prolapse is a support structure problem. So unless I as a surgeon fix this support, whether or not the uterus is there or not there doesn't make a difference. So there are many surgical options that we can use to help correct uterine prolapse without actually doing a hysterectomy. Similarly, there are some surgeries we do where we are doing a hysterectomy, maybe also using a mesh. Now, how we make that decision as a surgeon, there are many factors that goes into that conversation, and usually it's a very nuanced conversation with the patient, taking into consideration their individual risk factors, what are their goals and expectations, and what are some specific things we're trying to address at the same time. Long story short, if you have a uterine prolapse, hysterectomy is not the only solution. There are non-surgical treatment options, and even if you decide to undergo surgery, there are surgical options that does not involve a hysterectomy, and whether or not that is a good option for you is a discussion to have with your surgeon. So it's very important that you seek out a specialist, preferably a urogynecologist and a pelvic reconstructive surgeon who has a lot of experience taking care of patients just like you, who has a lot of experience dealing with all the different treatment options, so they can come up with a plan that works best for you. Okay, time to debunk some myths about uterine prolapse. Number 1, hysterectomy is the only fix. Well, hopefully after watching this video, you know that that's definitely not true. And even if you need a surgery, hysterectomy is definitely not the only option. Number 2, surgery requires a lot of downtime and you can't do exercises after that. Again, not true. As I mentioned, with most minimally invasive surgical techniques, most of the patients are going home the same day. Recovery, again, depending on how severe your surgery was, can be anywhere from 2 to 6 weeks, but you're not bedridden in those 2 to 6 weeks. And in fact, I encourage my patients to start walking, to start moving, start engaging in their daily activities so that they can recover faster. And when should you get back to exercises? Again, once you're cleared by your physician or your surgeon, there's no reason why you cannot exercise even after you had surgery for your pelvic organ prolapse. Number 3, prolapse only happens after menopause. I don't need to worry about it as a 30 or a 40-year-old. Again, not true. Many of my patients are women in their 30s and 40s. Maybe they were pregnant, maybe they recently had a child and started noticing some heaviness and pressure, went to see their OBGYN, and lo and behold, were told they have pelvic organ prolapse. Yes, age is a risk factor, so many women will notice that their pelvic organ prolapse gets worse after menopause as the tissue quality deteriorates. But again, menopause is not the only risk factor for prolapse or uterine prolapse. Uterine prolapse, especially if you've never heard about it or seen it before, can seem and look very scary. After all, it's your uterus, a body part that's trying to push through the vaginal wall. But hopefully after watching this video, you will realize that it is a common condition with some amazing treatment options that involves both non-surgical treatment options as well as surgical treatment options. So if you've been diagnosed with uterine prolapse or think you may have uterine prolapse, first and the best thing that you can do is to get yourself evaluated. And if needed, get yourself a referral to see a specialist so you can get the care as quickly as possible and come up with a plan that works best for your lifestyle. Don't be shy to ask questions. Don't be shy to ask for a referral. If you are somebody who's suffering with pelvic organ prolapse, let me know in the comments section what your experience has been and what are some treatment options you have been offered. If you like what you see, don't forget to subscribe. And again, please do share it with a friend because we need to start having these conversations without the stigma, without the fear. I'll be back again next week with another exciting video about your pelvic health. So make sure to tune in. Hope to see you soon. Bye.